Hello friends, do you know that we have a special gift now? Do you know I'm about to release some special fruits that will make your ovulation bim, and you will take in just in 1 month. What do I have here? Do you know? After you've been able to reset your system, flushing the infections from the system, keeping your environment clean, and all those stuff I talk about, your happiness to balance your hormone, this is another trigger that you have to do, and you are taking in. Where are my friends that are ready to take in? I'm going to treat how you're going to take in using those 3 factors. I have my banana there. Are you ready? I have my egg there, and I have my liquid milk. My patients are listening now. I know you know that I'm giving this thing out free of charge, and this January I want to get some testimonies, a special one of that. All right, let's go. Do you know that your banana has so much vitamins in it? Banana is a potassium rich food. It has a lot of vitamins, it has a lot of nutrients in it that helps us balance work and regulate our ovulation. Banana mixture with your liquid milk and raw egg does a lot of magic for you. It helps you boost your ovulation, whether you're in there for multiple children, whether you're there for twins and the rest of it, or single. This therapy, this skills, this particular method will help you to get instant pregnancy in 1 month. Okay, let's go. Your banana is a rich one. It has potassium in it. It has vitamin B6 in it. It has a lot of vitamin B6 that help in regulating ovulation and enhancing fertility. It has a lot of fibers in it. And you know what fiber does? Fiber helps you cleanse your kidney. It helps you balance your system. It reduces sugar intakes in your system. It helps you look very healthy, and whatever obstacle that is there in the system to stop you, it helps you go alongside to achieve the ovulation you want to balance, and then you take it instantly. Hello, okay, let's go again with the egg. Egg is rich in protein, which is essential for ovulation and fertility. It's essential for taking care of your ovulation, boosting the ovulation, regulating your hormones so well that ovulation will balance up and boost. Okay, it contains again choline. Choline again is a nutrient that supports hormone production and helps develop fetus during pregnancy. So it fits you so well that once you are pregnant, the child already is secured. All right, let's go for the liquid milk. Liquid milk, it's so rich in calcium. It's excellent source of calcium, and that calcium, you need it for your pelvics, you need it for the growth, for your fetus, you need it to regulate your ovulation very well. So the mixture of it, because it has those calcium, it has vitamin D again that supports fertility, which supports hormone regulation and fertility so well. You see, combination of this factor is already ringing bell and giving us what we want. All right, we have protein intake again in the egg, in the liquid milk. The liquid milk will go a long way to help the circulation of blood down there in the uterus. It helps in the production of hormones and helps in increasing your ovulation. Okay, why food supports your ovulation is equally so essential to understand that you have to mind the way you sleep, you mind your happiness, you have to put so much interest in balancing the way you sleep. Increase the quality sleep you already having, that you already been taught on how to do. Your overall health balances when your sleeping ability increases. Also play a crucial role in ovulation and fertility. Stay hydrated so well, drink more of water, take your exercises. Do you know that dancing helps you in taking in? That helps to trigger your hormones and make you balance up, make the sex and make the hormones fixing so high that it enhances the ovulation and you're taking in. Hello, so again we have to talk about hello, okay, again we have to talk about the right time to take the egg. Okay, when you see your menstruation the first day, whether it drops, whether it's a spot or it flows as normal, or it drops today and it did not come out the next day, or it came out the next day but it's still scanty, not flowing as rich as it used to be, please still count it. So the first day of your menstruation, the second day comes, and the third day, the fourth day, the fifth day, whether it's still scanty or whether it's flowing or whether it's bringing out the dark part of it, count it the fifth day. Early morning on that fifth day, you have already stored your liquid milk, 1 liquid milk, 1 big bananas, and 1 big egg. You know, so you get these 3 mixtures, get it as it is, and on the early morning of that 5th day, you mix it up together, blend it after you've opened it up, remove the peels and put up the main rich food. Okay, then you pour your egg, raw egg one, and you put your liquid milk inside it, the raw egg, the liquid milk, and the bananas. You mix it too. You just mix it together. Once you mix it together, you drink it completely as it is. Okay, so first, before you drink it, you must have drank at least 1 glass of water. You take it and then you take your liquid milk like that, your mixture like that, the combo. Once you take it, allow yourself. Okay, so on depending on what your cycle is telling you. If your cycle is on 28 days, if your cycle is 32, if your cycle is 25. Okay, let's break down on the better chances, on the better time to take your intercourse. Okay, if you're on 22nd or 25th cycle, you have to divide it into 2. Count it from that very day. You know, if you trace down what your ovulation was last month, if your cycle of last 2 months has maintained 25 days or 30 days, divide it into 2 and count from that 5th day. Count from that 1st day, 2nd day, 3rd day, 4th day, 5th day. So assuming it came out on the 1st of November or 1st of this very December, and 2nd, 3rd, 4th, and 5th, you've already taken the fluid. Continue counting. You count on the 6th day after you've taken it, 7th, 8th, 9th, 10th. From 11, 12, for those who have 22 cycle or 24 cycle and up, you divide it into 2. You have your ovulation on. You're already on the peak. Try and make love with your husband, and you see this very cycle will be a very special one, and testimony will keep counting. Okay, so let's go for those people who are long cycled patients. You know, those of my friends that are about 30, 32, you know, counting from the very first time you saw the menses, you count up to 15 days. In addition, with that 50 you've gotten, from the very first one you've gotten, assuming you saw your menses on the 20th, 21, 22, 23, 24, do you understand? 20, 21, 22, 23, 24, you take the mixture. Once you take the mixture, continue counting the 6th day, the next day, 7th, 8th, 9th, 10th, 11, 12, 13, 14. 15, you know, it becomes about 30, 31, 32. From that 14, 15, 16, your chances of taking in is so high. For those who are interested in sex selection and the rest of it, we'll talk about it. You can chat me up and we'll discuss that and balance it for you. Thank you so much. I am listening. I want a chat up of, I want those people who are ready to take in as fast as possible in 1 month. Please, this is the right time. Just click in, subscribe to our channels, click in, and you're getting your answers. You're taking in this month. Make sure the predisposing factor is already set. Make sure that the infection treatment is already resetted. Your body is reset. Make sure you're having enough happiness, enough rest. Increase your quality of sleep. Make sure you're balanced diet, other fruits that you've already been taking care of yourself by taking care of eating your fruit, taking your fiber-rich food, and the rest of it for this very month and the month ahead. Make sure once you're trying to take in, use these tips and knock on my chats and they tell me, look at what you've got so far, and I will smile the same smile with you. Thank you so much as well.